My name is Dr. Vibha Dubey. I am consultant pediatrician in SKG Hospital and visiting consultant in IIT Jodhpur and HPCL Pachpadra. Today, I am be talking about a very common complaint, that is cough. Cough is a very common complaint in children. It is very common for children to experience 4 to 5 episodes of cough in an year. Parents should not worry too much about cough because cough in itself is not a disease. It is just the reaction of body and protective mechanism of body against any foreign invasion. Most common cause of cough is a viral infection. It settles by itself in 5 to 7 days even if we don't try to treat it. Sometimes viral infection can also be prolonged and there is no need to treat it. But the problem with pediatricians is that parents are very much rattled by the cough and they want it to go away quickly. There are few relatively serious causes of cough. First is a croup. Croup is very much a barking cough. Barking means it produces a sound like a dog is barking. It takes place due to the swelling of structures around larynx, that is the voice box. And generally it is associated with a stridor, that is a typical sound. Another serious cause of cough is pertussis, that is also commonly called whooping cough. It is of rare occurrence these days because of the widespread immunization these days. It results in repeated distressing cough, which typically ends in vomiting, and it is associated with a whoop, which is a typical sound produced. And it is very distressing for the kids and the parents. Bacterial infection can also result into cough. When bacteria is involved, generally the cough is associated with fever. It is a dry cough if only upper respiratory tract is involved, and it is associated with sputum if lower respiratory tract is involved. Asthma can also lead to cough, but generally with cough there is difficulty in breathing, and it is associated with generally family history of asthma or allergy. Tuberculosis. It is one of the serious causes of cough, and the cough is generally of longer duration. It is generally associated with weight loss, anorexia, that means the child doesn't have interest in eating the food, weight loss, difficulty in breathing, production of sputum, foreign body aspiration. Sometimes the child is playing unattended and he ingests something which the parents may be aware or they might not be aware of what child is ingested, and it may just settle down into the respiratory tract. In that case, child suffers from repeated cough. Parents come with the complaint of repeated cough which has not been able to diagnose it, and for pediatrician, a very high degree of suspicion is required to track that kind of cough. Another cause of cough can be gastroesophageal reflux disease. In that case, stomach is the cause of problem. The acid can reflux from stomach to respiratory tract, and child may suffer from cough and wheezing. Heart disease. Sometimes, if no cause can be found, child should be examined by a cardiologist to determine if there is any cardiac cause of prolonged cough. But generally in that case, there are other symptoms associated with it. Post-nasal drip is another cause of cough. It is the dripping of secretions because of cold. In this situation, cough is generally associated with headache, itchy eyes and sore throat. Sometimes one of the parents can be a smoker, and there can be smoke in the environment, and child can become passive smoker and develop irritant cough. Sometimes teenagers are smoking and they are not telling the parents, and they can present as irritating cough. Child suffering from cough should be required to be examined by a pediatrician if the cough is more than 5 to 7 days of duration and it is associated with sputum, it is associated with prolonged fever, there is history of night sweats, and there is certain appearance of repeated cough, or there is loss of weight. Now coming to investigation. Investigation is required when cough is of prolonged duration. Blood count needs to be done to find out if there is a infection is the cause of cough. X-ray test needs to be done if infection of lower respiratory tract is suspected. CT scan can rarely be required if there is suspicion of some foreign body ingestion by the child. Peak expiratory flow rate. This is an investigation which is done by spirometry to find out the strength of inhalation and exhalation in the child. It is done if there is history of asthma or allergy in the family and we are suspecting it. If no cause is found, referral to cardiologist is a must to find out if there is cardiac cause for cough. Now coming to treatment. Searching the underlying cause and treating the cause is the most important part of the treatment. There is no need to suppress a viral cough. The child needs to be examined fully by the pediatrician, and after that just the parents need to be counseled that no drug is required and it will go away by itself after 5 to 6 days. Cough syrups, which is available freely over the counter, should not be randomly given to children suffering from cough. Young children can be given small amount of honey at bedtime so that the throat is soothed and the child sleeps peacefully. Now to older children, dextromethorphan can be given to suppress the dry cough. Antihistaminics like chlorpheniramine maleate can be given if allergy is suspected. Some drugs like ambroxol can be given to thin out the sputum so that the sputum is expectorated. Drugs like guaifenesin, they also help to loosen the sputum. Bronchodilators are the drugs that relax the tubules from which air passes. Bronchodilators are the drugs that relax these bronchioles, and then they can be prescribed and they can be helpful if allergy or asthma is suspected. Inhaled bronchodilators are more helpful compared to oral bronchodilators. If post-nasal drip is suspected, it can be treated by decongestant, antihistaminics, giving more fluids, nasal drop to clear mucus, and sleeping with head elevated put on the pillows. So I have told you everything of my knowledge, what I knew about the cough. It is a small piece of knowledge, but it is very important because cough is a very common problem affecting children. So I hope it is useful for it, and if you like it, kindly like, share and subscribe the video and press the bell icon. Thank you.